today we are in discussion with Dr. Edward Green, Special Envoy for the UN, and we have here also Dr. Martin, UNAIDS Director. Dr. Green, what is Guyana's progress on HIV and AIDS in terms of prevention and control?
Well, it seems to me that if we are to answer the question, we have to really look at the developments between, let us say, over the last 10 to 15 years. And when we compare the Guyana's status in prevalence, HIV prevalence in 2000 with 2015, I think that remarkable progress has been made. In fact, in 2001, you had about 7 to 8% of persons living with AIDS on treatment, and according to the figures for 2012, you have approximately 49% to 50% of the people living with AIDS. Although we need to increase that number, the remarkable progress is what I wanted to point out. Secondly, you have a major reduction in deaths from HIV in Guyana over the past 15 years. I mean, some 70% reduction in deaths. But most important, I think that you have something to celebrate in that Guyana is one of those countries in the Caribbean that could presently declare that it has eliminated mother-to-child transmission for HIV/AIDS. So, in fact, when you look at some of those statistics, Guyana is doing very, very well in this regard. But there are some challenges that you face, notwithstanding. One is when we look at the information provided to us, we note that there is an increase in certain areas, among certain populations, including young people, where there's a tendency for a spike in the prevalence, as well as men who have sex with men and sex workers. What is really a problem, biggest problem, is the fact that HIV is being linked now to the trafficking in persons. In particular, young girls, some younger than 15 years of age, with the possibility of the increases in AIDS from that sexual contact and that kind of relationship. So we are having to focus on the successes, of course, but we also have now at this time to focus on the challenges, because what we are trying to advocate from the UN, not only for Guyana but for the entire Caribbean and the world, is that we are hoping to aspire to end the HIV epidemic by 2030.
Okay, Dr. Martin, in terms of mother-to-child transmission, I know Guyana has been doing well in this regard. What are your thoughts?
Well, the mother-to-child transmission is, as has been alluded to, an area that in the Caribbean and in Guyana as well, have definitely been doing quite well. And as you know, the world would like to eliminate mother-to-child transmission. And to do so, they have to reduce the infections from the mother to the child. And this involves ensuring that mothers access treatment. So, yes, Guyana has been doing very well. We are now at a point where we need to determine whether they have reached the WHO and the UN AIDS agreed level, or when you could say they have eliminated mother-to-child transmission. This requires some form of study which has to be undertaken, and we are hoping that in the course of the next few months this type of survey can be done to ascertain exactly whether we could say that Guyana can be certified like Cuba has been. You may have heard that Cuba has been certified as one country that has eliminated mother-child transmission. There are a few other countries in the region that are also thereabouts to be certified, and most of them are in the Caribbean region. So the Caribbean is one region that we hope to be the first to declare that they have eliminated mother-to-child transmission.
Yeah, you can ask.
Okay. What of stigma and discrimination with respect to HIV and AIDS? I know that you've been doing some work with PANCAP on that. Could you give us some information on that with respect, I mean, generally the Caribbean, but narrowing it down to Ghana as well?
Sure. One, I would say there are three major pillars for the elimination of the epidemic, the AIDS epidemic. One, treatment, prevention, and HIV-related stigma and discrimination. Those three are the pillars. Those are the things that we have to do in order to end AIDS. And you ask about stigma, which is really very, very important, because to the extent that people feel discriminated or stigmatized, to that extent, they don't come for treatment, and they can't be given preventive measures. And so what we have to do is to try to see how best we can eliminate stigma and discrimination. You mentioned the PANCAP partnership, and PANCAP, in collaboration with UNAIDS, initiated a program called the Justice for All program. And the Justice for All program was really a response to the United Nations high-level meeting political declaration, which aimed at getting us to zero and accelerating the response. But in fact, that PANCAP Justice for All program was wider than just eliminating stigma and discrimination. It had to do with a series of things, and I will get to the stigma and discrimination just now, which included improving family life and treating with those in need. It dealt with the issue of increasing the access to affordable medicines. Dr. Udit referenced that just now. It also deals with the issue of sexual and reproductive health and rights, that is, dealing with the knowledge, imparting the knowledge so that you can get behavior change, knowledge about sexual relations, sexual education, not only in schools, but out of school, and also, as we discussed with faith leaders only yesterday, in Sunday schools also. So the sexual and reproductive health and rights is an important aspect, and more important for us in Ghana is what we alluded to just now, the issue related to gender equality. And that includes really the issue of reducing violence against women, girls, and children, which is so rampant here in Guyana, reducing teenage pregnancies, and because of the health consequences of that, you have a fairly high percentage of teenage pregnancies, that is, of people 19 years and below. 21% is the figure, the latest figure that we have. And we also are concerned too about the wider issue of cervical cancer. So those are four things. But the fifth pillar of that is the stigma and discrimination, in which stigma is really driven by the behavior and the rejection of people living with AIDS by the wider population, including health workers, including teachers, including your priests and pastors. And so what we're trying to do in Justice for All is to bring people along in the context of reducing stigma and even eliminating the kinds of prejudices that can fan the flames of this disease and cause. So sometimes people say we are pushing a gay agenda. Well, we're not. We're pushing an agenda that deals across the board with reducing stigma against children, against women, against people with different sexual practices. And so this is what the thing is all about. And in fact, we are assisted quite a bit, and we hope in Guyana, by ministries of education, of health, of social cohesion, and of course, social protection. But it shouldn't be limited to those ministries. It should be across the board, because to eliminate stigma and discrimination, we also need our Minister of Finance to increase the support for this venture. And we hope that we have our people in the media that will help us to articulate the need for that intersectoral approach to the problem.
On that note, what has been, I know you spoke about Guyana specifically, but what has been the national response across the region like, because I know that Justice for All, correct me if I'm wrong, subject to correction, that Justice for All program was aimed at reducing stigma discrimination by 2015.
Yes.
What has been the overall response by individual governments?
Well, let me just say that the Justice for All program revolved around national consultations, and our first consultation was in Guyana in 2013. And yes, we did have really aspirations that we could get the declaration passed, but that didn't really happen because certain elements of the church objected to a couple of the elements of the declaration, especially those having to do with sexual and reproductive health and rights and the abolition of the punitive laws. So consequently, our Council for Human and Social Development requested that we go to the table and reorganize, and they recommended that we try to see how we could implement the 15 elements of that recommendation in short, medium, and long-term scenarios. So consequently, now to answer your question, most of the stakeholders in the Caribbean agree that this strategy is a good one, because there are a couple of things that we can implement immediately. Like, for example, we could implement the discrimination of people at the workplace, put into effect those policies and programs. Right away, we have the issue of working to accelerate the reduction and elimination of mother-to-child transmission. And there are quite a few things we can do like that. In the medium term, we're talking about those issues related to getting universities involved and other research agencies in research so that you can research to policy, so that you have a evidence-based so on. And so if you would look at the declaration, I'll give you a copy, you will see that we are moving towards implementing the elements of the declaration in short, in medium term. And one of our short-term things that we hope that by 2016, that was the benchmark, we could have the entire Caribbean declared as having eliminated mother-to-child transmission. It's going to be a struggle because some countries are lagging, but that is the way that we aspire to implement the declaration.
Sir, you mentioned the workplace policy in HIV and AIDS. How has workplace across the Caribbean adapted or implemented this policy?
Well, you would probably know that PANCAP, in collaboration with its partners, Chief Among whom UNAIDS, developed a work, what they call anti-discrimination policy and an anti-discrimination model legislation. And the two instruments had within them guidelines for countries. With respect to workplace policies, the guidelines were structured in certain categories, and there were 3 categories. And of the 3, most countries in the Caribbean, if you were to take the 15 big countries, I can't speak about the associates, last year 13 of them had implemented level 1 and level 2, and about 10 had gone level 3, which meant that they had put in practice the elements for workplace policy to be implemented. Now, that too is achievement, but we could still have gotten everybody to do it. But you know how things happen in the region, changes of governments, and therefore you have to start over again. So with respect to workplace policy, I think we have a healthy movement towards achieving it in the short run, meaning hopefully by the end of 2016.
You mentioned in your opening, you said you outlined challenges that are linked to the elimination of HIV and AIDS. One of them being TIP.
Yes.
What suggestion or what mechanisms you think that could be put in place to address this particular issue?
Well, the trafficking in person is something which is worldwide. But if you were to deal with Guyana, it is very troubling because in Guyana, the trafficking in person, we are told, is really something that affects very, very young people, young girls in the mining districts, and with really serious public health implications, and specifically implications for AIDS. So really, how we could tackle it is we need to have the community workers, we need to have the technical people provide us with the types of policies that we need to implement, but most important, we need champions. And what I would tell you from our discussions, both Dr. Udit and myself, our discussions with a range of people here, is that we have found some champions that would help us to try and take the message and try and implement the policies, put legislation in place and enforce it, put guidelines in place for schools and community centers, and give an awareness to adults about the need to protect the rights of children who are displaced, and really inform the law enforcement services and ensure that they can implement. And one of those champions is no other than the First Lady, who is a champion for the overall every woman, every child policy, but within which is what you call the TIP, the trafficking in persons, with special reference to young girls.
I believe there was the view that we need to rethink the epidemic as a moral issue. That was what was said, I think, through PANCAP in the past. What are your views on Guyana's approach to the HIV/AIDS issue?
Well, I would like us to put it in a broader basis and ask Dr. Udi to put a framework for us, a UNAIDS framework,
yes,
within which we have to take this thing forward for ending AIDS. And I think because we take our cues from UNAIDS with its international and global reach.
No.
Well, thank you very much, Dr. Green. You know, moralizing the AIDS response creates in itself stigma and discrimination. So the view is that we should distinguish between the moral element and a recognition that the key populations affected and infected by HIV and AIDS need to access HIV prevention as well as So do I start from where? Okay. Yes. So we need to appreciate that we have to do everything that is possible to remove social barriers that would affect the uptake of services by those most affected and those who are infected with HIV. And if we go the route of moralizing the response, then this will not happen. Ours is an inclusive approach and not an exclusive approach to ensure that each and everyone has the right and access to HIV and AIDS services, regardless of sexual orientation, regardless of status, regardless of tribe and etc. So that is the framework within which we operate. And we are saying that if we are to achieve the target of eliminating or ending, for that matter, HIV and AIDS by 2030, then we must also address those social barriers. We must remove stigma and discrimination. We must provide an enabling environment where the laws do not, deter people from accessing services. And we must ensure the services are available, are readily available, and user-friendly to all these groups. We should also recognize that some populations are more at risk than others. In other words, we should take into account the epidemiology of HIV and AIDS. I know sometimes we are inclined to move very politically and ensure we're everywhere, but that can sometimes be very wasteful with resources. Now that we are having shrinking domestic funding, we need to see how we can do more with what we have, or even with less. And so we have to be smart in our choices. Our choices must be evidence-informed. We must know where the disease is, where the infection is, and put our resources there. This may be population directed, or it may be area directed. But also, we must use interventions that have known proven efficacy. Interventions that have been shown scientifically that they can actually reduce infections, they can actually reduce AIDS deaths. So this is the approach, and this is the thinking around the framework, the new UNAIDS strategy. Now, if we did this, then we can see ourselves going to the coverage that we would like, and that is a coverage of 90% of the people living with HIV knowing their status, and of those, 90% of those receiving antiretroviral drugs for treatment. And then within those, you would expect then that the level of the virus in their blood has reduced to such a level that they are not at risk of transmission, and so would contribute to prevention. Now, that is the principle around the strategy. We are saying that if we can achieve what we call these 90-90-90 targets, then we will end AIDS. Then we will reduce AIDS from being a serious public health threat. And we shall reduce it to an extent that it becomes manageable sustainably. As we speak now, if we look at the trajectory in countries, including Guyana, if we don't move up to the 90%, then the likelihood is that in the near future, when I say the near future, I mean in the next 5 years, we're likely to have a situation where the epidemic may unbearably be sustainable. And the response. And this is what we will not like. So we are saying, invest today for tomorrow.
Thank you very much.
That's it?
I have a question.
Sure.
Not necessarily for news purposes, but we spoke about discrimination in the workplace briefly. Based on the research that has been done, could you say how prevalent it is in Guyana?
At the workplace? We don't have, as far as I know, the kind of evidence that would tell us prevalent. But what we do know is that from our discussions, and we've had discussions with the private sector, you know, and the government we know has already over this last 10 years implemented the policy that really would eliminate discrimination in government services. And I have all reasons to believe, based on what we know of the private sector, that they too have been informed. But I can't give the precise figure for Jamaica, for Guyana, but I could, if you had asked me. For Jamaica, it's very high, and there are laws enforcing the appliance, and the monitoring and evaluation process in Jamaica is there because of the vigilance of civil society. And so your question has led me to supplement both what you asked and what Dr. Udit said. Now, when you spoke about the moral issues involved, and Dr. Udit spoke about the scientific issues, what we are seeing is that we are having a lot of partners now recognizing that 90-90-90 is a very important target base to go. And this is especially so as we move from the goals for 2015, which we call the Millennium Development Goals, towards the Sustainable Development Goals. And what we're recognizing more and more is that although we have to, and one of the targets is to end AIDS by 2030, we are recognizing that it's bigger than AIDS now. We are speaking about AIDS in relationship with other diseases like NCDs, because a lot of people with AIDS on treatment, are tested and in treatment, are living longer and are dying of other diseases. So in fact, as we move towards the 2030 Sustainable Development Goals, we do have this element of the integrated health approach. And we also have an understanding with the government ministers with whom we spoke today, that approaching this thing as an intersectorial, interministerial, is the best way of dealing with it. And finally, I wanted to say something because there's an addendum to your moral question. The faith-based organizations are now involved in a program, and I think they're very seized with the notion that justice for all must mean greater compassion, greater mercy, greater reaching out, and embracing those people in need, including people with different sexual preferences that are so stigmatized in the context. So I think we are moving in the right direction, but we need support, and hopefully members of the media would help us, you know, to provide those stories and to provide the analysis that would give guidance to the communities we serve.
Thank you very much.